Welcome back, feline friends and dedicated pet parents. Today, we are diving deep into the secretive world of cat health. Did you know domestic cats are evolutionary masters of disguise? Unlike dogs, cats remain biologically hardwired as solitary hunters. In the wild, showing weakness attracts larger predators. As a result, our beloved house cats possess a profound instinctual drive to mask their symptoms of illness until their bodies simply cannot compensate anymore. Shockingly, research suggests that approximately 95% of cat owners are completely unaware of the subtle, microscopic shifts in behavior that precede a catastrophic health failure. We often fall victim to the self-sufficiency myth, falsely believing cats require less medical oversight. But waiting for obvious distress is a dangerous game. By shifting our perspective and monitoring for small deviations from their normal baseline, we can save their lives. Here are the 4 silent danger signs you absolutely need to know. The first silent danger sign lies right inside your cat's food bowl. Because eating is a rigid daily habit, it serves as the ultimate barometer for your cat's well-being. However, because of their masking instinct, a cat will often continue to visit the food bowl and consume calories, even when suffering from severe systemic illness or excruciating oral pain. Therefore, you must monitor how they eat, not just what they eat. Watch out for shifts in their consumption velocity. The transition from a fast eater to a sudden grazer who takes multiple small breaks is a massive red flag. It often points to localized oral pain or gastric nausea. Noticing your cat dropping food suddenly after a bite is known as the hot kibble reflex. This highlights acute pain from exposed tooth pulp or tooth resorption. Unilateral mastication, which is tilting the head to one side while chewing, strongly suggests a localized dental fracture or a painful oral ulcer. On the flip side, a sudden, frantic increase in appetite, known as polyphagia, is equally concerning. In senior cats, this ravenous hunger paired with weight loss is a classic hallmark of hyperthyroidism or diabetes mellitus. You should also observe their eating environment carefully. A cat that frequently pauses to look over its shoulder is a lookout eater, signaling chronic environmental stress. Furthermore, if your cat repeatedly pours food out of a deep bowl to eat it off the floor, they might be suffering from whisker fatigue, a painful sensory overload caused by their vibrissae constantly brushing against the bowl's edges. Our second silent danger sign is found in the litter box. When a cat suddenly stops using its box, owners frequently assume it is acting out of behavioral spite. In reality, shifts in elimination are almost exclusively indicative of severe physiological distress. Significant increases in water intake, polydipsia, and urine output, polyuria, are reliable early indicators of systemic disease. As kidneys fail due to chronic kidney disease, they cannot concentrate urine. The result is large volumes of dilute urine, forcing the cat to drink excessively to stave off dehydration. If you notice larger clumps in the litter box, or if your cat suddenly starts drinking from faucets and toilets, you must contact your vet immediately. Conversely, straining to urinate or making frequent, unproductive trips to the box is a life-threatening emergency, particularly for male cats experiencing a urethral obstruction. Do not ignore gastrointestinal indicators. Chronic constipation is a silent danger that frequently goes undetected. The production of small, hard, dry marbles instead of pliable stool is an early sign of systemic dehydration. Finally, eliminating outside the box is heavily linked to mobility issues. For a cat suffering from osteoarthritis, stepping over the high rim of a traditional litter box is agonizing, causing them to seek out flat, accessible surfaces like your carpets. The third silent danger sign involves subtle behavioral plasticity. Cats are notorious creatures of habit, meaning any deviation from their established social routine is a massive red flag. When illness strikes, it typically drives one of two divergent social shifts: extreme withdrawal or uncharacteristic hyperattachment. Social withdrawal is a primitive defense mechanism. A sick cat will hide under beds or in closets to minimize the risk of predation while in a compromised state. Alternatively, some cats respond to internal distress by becoming incredibly clingy, seeking the perceived safety of their primary caregiver. Sudden irritability or aggression when touched along the lower back or mouth provides a clear, silent signal of localized discomfort. Mobility adaptations are another crucial piece of the puzzle. Osteoarthritis is chronically underdiagnosed in feline medicine because cats do not overtly limp like dogs do. Instead, they use behavioral workarounds. An arthritic cat will stop making direct, high leaps and will start looking for intermediate steps to reach their favorite spots. You might also notice the hunched loaf stance, where the cat sits rigidly tense rather than stretching out comfortably. A decline in coat quality, marked by matting or dandruff along the spine, often indicates that the cat is experiencing too much spinal or joint pain to properly groom themselves. Even increased nighttime howling can point to cognitive decline, hypertension, or hyperthyroidism. The fourth and final danger sign requires you to perform simple physical observations at home, starting with the mucous membranes. Your cat's gums provide a direct, transparent window into their circulatory and respiratory health. A healthy cat's gums should be a consistent bubblegum pink and feel moist. If the gums are pale pink or porcelain white, your cat could be experiencing severe anemia, internal bleeding, or acute shock. Blue or purple gums indicate cyanosis, meaning the blood is not carrying sufficient oxygen, representing a life-threatening emergency. Yellow gums are a sign of jaundice, pointing to serious liver dysfunction. You can also test their capillary refill time by gently pressing the gum until it turns white. The pink color should return in under 2 seconds. Anything longer indicates low blood pressure or circulatory failure. Finally, beware of the illusion of the healthy coat. Weight loss in cats is often gradual and easily obscured by thick fur. A loss of just 1 or 2 pounds can represent a massive 10 to 20% reduction in total body mass for an average cat. Perform regular body scans by running your hands along their ribs and spine to feel for muscle loss, which is often the only outward sign of chronic kidney disease or intestinal lymphoma. By understanding these 4 silent danger signs, you can shift the paradigm from reactive medicine to predictive, preventive care. The transition from waiting for a visible crash to monitoring microscopic deviations is the most significant advancement in feline healthcare. By tracking their eating mechanics, elimination patterns, behavioral plasticity, and vital signs, you become your cat's greatest health advocate. Remember, the burden of detection lies on us. We must learn to understand the silent language of feline distress to protect a species that is genetically programmed to never ask for help. Thank you for watching, and please subscribe to learn more about keeping your furry family members safe and healthy.